I think the way AI can help in medicine is just to support clinicians throughout the patient pathway to make better decisions. So before surgery, in my case, that might mean helping a clinician pick up a disease earlier. During the surgery, it might help them identify structures and decide what to do next. And after the surgery, it may be allowing surgeons to more easily pick up when something's gone wrong. My name is Hani. I'm a consultant neurosurgeon at the National Hospital for Neurology and Neurosurgery. I'm also a professor at the UCL Queen Square Institute of Neurology. We're hoping to use AI to analyze operations in real time and provide surgeons with feedback to make those operations safer and more effective with the hope of improving patient outcomes. The AI is able to first and foremost recognize the anatomy, second to understand the instruments that we use, and by looking at the anatomy and the instruments to identify the steps of the procedure. It can advise us when there's a critical part of the operation. It can advise surgeons what the best thing to do next might be. It could tell the anaesthetists how much time is left in the surgery. It could tell the theatre nurse which instrument to use next. So it really provides a lot of information for us. We've actually already started to use AI after operations to provide some feedback to surgeons. And it's pretty analogous to the sort of post-match analysis that you might get after a football game or something like that. In getting that information, surgeons can learn to do the operation better. And we found that has already improved patient outcomes with reduced length of stay, fewer complications as a result. In answer to that question of whether AI will replace the doctor, I think a doctor using AI will replace a doctor not using AI. And I really think that to be true. I think it will just become a technology and tool, like in everyday life, that people adopt and in adopting it, do a better job than those not adopting it.